So just to reiterate, the idea here is backward design. And what that means is you want to jump way over here to what are your big ideas? Or what are your understandings? Or what skills can a student take on that then are transferable? So if they can do this in one area, they can do this in another area. And so once you have that, you need to come up with assessments. And in our class, there are some essays like you have to explain how cardiac drugs work. And how to explain cardiac drugs, you have to know the action potentials in the heart and how those are based on ion channels and how drugs affect those ion channels to affect heart function. So that's a pretty big essay that relates anatomy to physiology to clinical care or pharmaceuticals. And then before that, you need to have the tools to get the understandings or big skills, big ideas. So that's where I'm coming from here. So in AP, sometimes I rephrase this as why AP2. And I'll draw a circle around that. And these are the big understandings. The first one for me is critical thinking. And I know that you ask any teacher, and I'm not trying to knock anyone, but you ask any teacher, what do you want to get across to your students? And they're going to say critical thinking. But I wonder how, and I admit that it was, a good 6 years into my teaching before I actually asked this question. But then I did ask this question for critical thinking, is you have to ask questions. One, ask questions. So all of learning begins with asking questions. But then you have to start to answer those questions with digital literacy. You have to know good sources versus bad. You can't base an understanding of something on bad sources. You also, and this doesn't apply a whole lot to AP2, but you have to avoid logical fallacies. So like confirmation bias, where you tend to trust people who you already agree with, or you only go to certain sources, or you avoid appeal to authority, or things like this. These are sometimes called retological fallacies, and there's a lot of them, straw man arguments and things like that. You also have to use social collaboration, because sometimes two brains are better than one, or three brains are better than one, or it gives you a different perspective, or it gives you a different perspective. So you have to use social collaboration. Another big one you run into in AP2 is you have to conceptualize. Or another way I say that is see the big picture. See the forest from the trees. It's not enough to memorize facts. You have to know how they connect, so you have to see the big picture. And of course, at the end of this, you should have answered your question pretty reasonably, so ask another question. And so you create a cycle of critical thinking that's going to make you smarter and smarter and smarter. Now, the second one that I think is important in AP2 is you have to simplify the complex. And here's where I lean on. I used to read Richard Feynman's lectures on physics because he could lecture the most complex physics in a way I could understand, and he made me feel brilliant. And so he was very good at simplifying, and he would say if you can't explain something to a 10-year-old, you don't understand it. Or Einstein was similar that way. Now they would say sometimes I get out of that realm, but for the most part they should be able to explain things to a 10-year-old. And I would hold myself to that too, that I really believe that I could teach this class to a 10-year-old. Or I used to think about, could Ella understand this when she's a 10-year-old? And I think so. She probably need more time, but she could understand it. So there's three areas where I want you to focus on to simplify the complex. The first one is feedback. And remember from AP1, there's two types of feedback. There's negative feedback. And this is when you want to balance a stimulus. You don't want blood pressure to go too high. You don't want blood pressure to go too low. You don't want blood sugar to go too high. You also have positive feedback, and this is where something grows and grows and grows to climax. So something like childbirth. So the baby's head pushes against the cervix reports this to the brain releases oxytocin goes down to the uterus and tells the uterus to contract harder. The uterus contracts harder, pushes the baby's head into the cervix even more, tells the cervix to tell the brain to release more oxytocin, and so it builds and builds and builds. So that's positive feedback. I also want you to simplify the complex, and this is going to happen a lot in AP2 because you're going to talk about how the heart, the lungs, and the kidneys can really, really mess each other up. And so organ, system, interrelationships. That says interrelationships. This is the... Okay, so, I mean, a big one for us is going to be the heart. Can really mess with the lungs. Can really mess with the kidneys. They can solve each other's problems, but they can also create problems for each other. And that's just an example. The other one that I want you to use for simplifying the complex is hierarchical relationships. And what I mean by this is early in AP1 you would have known that atoms connect to molecules, connect to organelles, and that goes into cells. I'm gonna start over. And that's going to go into tissues. It's going to go into organs, organ systems, and organisms. Can I make it? Not quite. So diseases like cystic fibrosis are a good example where the real problem is chloride. Chloride doesn't move. And if chloride doesn't move, sodium doesn't move. And if sodium and chloride don't move, then water doesn't move. So sodium and chloride are ions, then water doesn't move. And if you can't move water, then you can't dilute mucus. And if you can't dilute mucus, then mucus will cover over the lung tissue. So it will cover over the simple squamous cells that are in the lung. So then you can't breathe in as much oxygen. And if you can't get as much oxygen, then the lung can't take in as much oxygen. And then that's going to affect organ systems because the brain is not going to get enough oxygen. And the key to knowing that and why it's a simplifying the complex thing is because you can cure the problem or fix the problem at multiple levels. Like one of the things you do is you try and get rid of the mucus, or you try and put in another ion channel to fix the problem. Or maybe you give the person oxygen, which is a molecule, or maybe you give the person a lung transplant, and that's an organ. Or the special thing with CF2 is it affects multiple organ systems from reproductive to digestive to the respiratory system. All right, so the last one that we're going to do, and this one's kind of a really complex one. So when I draw this arrow, leave a little space under here, because what this one is the principle of complementarity. So this is something called the principle of complementarity. And what this means is, how does anatomy, which is how things look, relate to physiology, which is how things work? It's going to be a little tight squeeze here, but we have 4 areas we're going to do this. We're going to relate this often, anatomy to physiology to disease. I mean, the reason you're in this class is because eventually you're going to be treating people, for the most part. So we're going to constantly in this class relate anatomy to physiology to disease, kind of like I just did with cystic fibrosis. Anatomically, there's mucus over the alveoli, so oxygen can't get through those, and that leads to the symptoms of cystic fibrosis. We're briefly going to do this at times. We're going to relate this to pharmaceuticals. Now, we're not going to cover it all, but we're going to create a foundation so you start to see Like I said before with cardiac drugs, how does a cardiac drug affect the action potentials in the heart to affect heart rate and heart strength? You've heard of, most people have probably heard of things like beta blockers or maybe some calcium channel blockers, or certainly would know that adrenaline is going to speed up the heart. So we'll do that occasionally. We'll also relate anatomy to physiology to clinical testing. So we'll do things like in the lab we'll do urinalysis, or we'll talk about urinalysis, or we'll talk about how you can do pulmonary function tests to figure out, like in CF, how is that affecting breathing, and what it can do in the lungs is it can make it harder for the lung to expand, so you can't breathe as much air in. We'll also briefly touch on clinical care. And not really to make you clinicians, but also just to let you know your own, how can you improve your own health? So for example, those of you that work in a hospital setting, you know that if someone's on bed rest for a long time, there's something called the skeletal pump. The skeletal pump squeezes veins, and when it squeezes the veins, it pushes the blood back up to the heart. So if you're on bed rest, you don't get that squeeze, and so fluid tends to accumulate in the legs. And so you can do various things from compression to elevation to something called serial compression devices. And here again, there's always a thread in this class where I also think you can apply anything to anyone that's not necessarily going into nursing. My daughter plays a lot of soccer. She used to run a lot. But so what we would get for her is, obviously we would cool her legs afterwards just so that there wouldn't be so much inflammation. But we would also get these little compression devices that would compress her legs so she would not get swelling in her legs. And so that's where a lot of the things in here can relate to clinical care, but also can relate to personal care. And you're going to hear me say this multiple times, and it's so exciting to teach this class right now, because if you get these 4 things up here, there are plenty of tools that are available for you right now for you to make sense of. So if you have the Apple Watch that does EKG, you kind of want to know the clinical testing that we're going to talk about with EKG, because then you understand what your Apple Watch is telling you. I mean, not big things. You're not going to be a clinician, but you could see things like changes in the T wave, changes in the P wave. You could see those kind of things, and you could do your own clinical testing on yourself. And if you can't afford a $700 Apple Watch, there's a $100 EKG out there that's called a Cardia. So more and more, if you think that you can't breathe, you can buy yourself a pulse ox, you can check your own blood glucose. So these things are just not about A&P necessarily, or people that are going into nursing, but these also are things that, you're going to want to apply a lot of things in this class, or maybe asked to apply sometimes. Like, I really like it when you do the cardiac drugs question and somebody comes in with their dad's medications. So why AP2? Because I want it to have meaning. I want it to be authentic. I want you to have transferable skills that will help you down the road. All right, so those are the big ideas. Thank you very much.